Hey everyone. So when we talk about mood disorders, there are a lot of common misperceptions, and there's also a lot of confusion about what the differences between the five major mood disorders are. I've always found it easiest to keep track of them by visualizing them on a graph in terms of how the mood is fluctuating. So I will share with you my wonderful artistic skills in terms of how I normally draw this out, just in case this is helpful for anyone. And then I'll do a second video where I highlight some common misconceptions about mood disorders. So I will scoot myself out of the way here so you can see what I'm doing. So with this graph, move myself up here. With this graph, imagine that this line represents your baseline mood. Okay. So to start off with, major depressive disorder, you have these big swoops down from your baseline mood called major depressive episodes. With persistent depressive disorder, which is also called dysthymia, you are pretty much always staying at a low level of this persistent chronic depression. You can blip back up to baseline mood, but what you see is somebody who's just, think about Eeyore, right? You see somebody who's just consistently a little bit depressed. They're a little bit under that baseline. And compared to major depressive disorder, where you have these huge swings up and down. Now, a person with major depressive disorder, when they're not in one of their major depressive episodes, they can have very positive, elevated, happy mood. Where again, dysthymia is just kind of it's somebody who's always kind of blue. Now, cyclothymia is where you have that same persistent low level of depression, but you also have mild or hypomanic episodes. So they don't go into full manic episodes. They go into hypomanic episodes where their mood is slightly elevated. With bipolar 1, what you see is the major depressive episodes again, but in between those, you see full manic episodes. And again, if you have some confusion about what is the difference between a hypomanic and a manic episode, your textbook does explain that very well. So I would recommend re-referencing that. But so bipolar 1, you're having full manic episodes and depressive episodes. Now, one caveat with bipolar 1, you don't have to be having the major depressive episodes. You can have hypomanic episodes mixed in it. But the key feature of bipolar 1 is you are having the full manic episodes. And then bipolar 2, you're back to having these hypomanic episodes, not full manic, hypomanic episodes. And you are having the major depressive episodes. So you can see that how we categorize it basically depends on how far down are you going, how far up are you going, and there's combinations for each of these. Now to talk about length, and I'll get more into this in my next video where I clear up some misconceptions. A major depressive episode must last at least 2 weeks. A manic episode must last at least 1 week, but it can last for several months. Now, we don't really have good data on how long hypomanic episodes last. And the reason for that is because a lot of people feel good when they're in a hypomanic episode. They don't go in right away. They don't report it right away. It feels like a break in their depression, which I'll talk about a little bit more later. So we don't really have good data on how long those tend to last. Most experts estimate probably a few weeks. Now, a lot of times we misuse the word bipolar disorder as mood swings, right? This person was really angry, really depressed yesterday. They're in a really great mood today. That is not how it works. These cycle very, very slowly. So rapid cycling or typical cycling is 1 to 2 full cycles in a year. Rapid cycling, I'm in the way. Rapid cycling is 4 cycles in a year, so 3 months each, right? So the swings from day to day, week to week, not how it works. I'm running out of time on this video. I will continue in video 2.